One of the scariest things in early pregnancy is not knowing when something could go wrong. A lot of women don't talk about this openly, but the truth remains that many women quietly worries about miscarriage. So if you ever find yourself overthinking every little symptoms, every little pains, or maybe every little movement, you are not alone. So in today's video, I'll be explaining two main reasons why early miscarriages happens. There are several reasons that can cause miscarriage, but in this video I'll be focusing on two main reasons. So just grab your copy because this video is going to take a little bit of your time. And if you're coming across my channel for the first time, you're welcome. My name is Uche Chichizendu, a clinical physiologist. Do well to hit the notification bell so that anytime I post a new video, you'll be notified. Now let's get into business. Firstly, let's understand what a miscarriage really means. Miscarriage happens when a pregnancy ends on its own before 20 weeks, but most of them happens in the first trimester, especially before 12 weeks. And this is very important because many miscarriages even happens before a woman notices that she's pregnant. So if you're early in pregnancy, just know that this is a delicate stage. Now let's talk about the number one cause of early miscarriage, and number one is chromosomal abnormalities. Now what does this mean? It means that when the baby was forming, something didn't develop correctly at the genetic level. Now listen up, chromosomes are tiny structures inside every cells that carries genetic information. They carry our genetic materials, also known as DNA. Every human cell normally has 46 chromosomes, 23 from the father and 23 from the mother. These chromosomes contains information of how the baby will grow, the organs, the heart, the brain, everything. Now, chromosomal abnormalities happens when there is too many chromosomes or too few chromosomes, or chromosomes that are even damaged, or maybe they are incorrectly arranged. This usually occurs at the moment of fertilization. That's when the sperm meets the egg. That's when the sperm meets the egg, fertilization occurs. These chromosomal abnormalities normally occurs that period, or maybe very early after. And one of the most common type of chromosomal abnormalities is aneuploidy. That's either one missing chromosome or an extra chromosome, either 47 or maybe is 45. When there's an extra chromosome, that's 47, we call it trisomy. Now, when there's a missing chromosome, that's 45, we call it monosomy. A well-known example of chromosomal abnormalities is Down syndrome, and it falls under a trisomy, that's extra chromosome. While many other trisomies are not compatible with life, and this can lead to early miscarriage. Now, another type of chromosomal abnormalities is polyploidy. Now, in this type of chromosomal abnormalities, there is extra set of chromosomes. Instead of 46, there is extra 69. This is a severe abnormalities and almost always results in early miscarriage. That's this type of abnormality, that's chromosomal abnormalities, always result to miscarriage. And another type of chromosomal abnormalities is structural abnormalities. Now listen, in structural abnormalities, the number of the chromosomes may be correct. That the numbers there may be correct, but either a piece is missing, a piece is duplicated, or some parts are rearranged. This is what we call translocation. This can interfere with normal development. Now, why does chromosomal abnormalities causes miscarriage? Now listen, for a pregnancy to continue, the embryo must develop properly. Chromosomes control cell division, organ formation, growth signals. When there is a major chromosomal error, the embryo cannot develop properly, cannot develop normally. Vital organs may not form correctly. Growth may even stop early. So the body naturally ends the pregnancy. About 50 to 70% of early miscarriages are due to chromosomal abnormalities. Most occur in the first trimester, that's before 12 weeks, while others, many of them even occur before the woman realizes that she is pregnant. That is why some women, they will have some symptoms of pregnancy, or maybe their period might even cease for 3 days and it comes back again. Some of them don't know they are pregnant, but what they are undergoing is miscarriage due to chromosomal abnormality. Now, for number two causes of early miscarriage is hormonal issues. Now, I'm going to take my time to explain this one. especially low progesterone. Progesterone is very essential in early pregnancy because it supports the womb and keeps the pregnancy stable. If the levels are too low, it may affect how the pregnancy develops. That is why some doctors prescribe progesterone supplement just to support this pregnancy in early stage. Progesterone is mainly produced in two places depending on the stage of the pregnancy. Now, for the early pregnancy, progesterone is produced in the ovaries. Now, for late pregnancy, that's 12 weeks, then the placenta takes over. Now, listen up, before ovulation, that's your follicular phase. Your LH and your FSH stimulates your ovaries to prepare for egg, to prepare to release a mature egg. The ovary develop a follicle, that's a sac that contains egg. At this stage, progesterone is still low. Now, when ovulation happens, that's when the ovary releases the egg because LH must rise before ovulation occurs. So, when the ovary releases egg, after ovulation, that follicle that released that egg becomes empty. That structure turns into the corpus luteum. This is the main producer of progesterone. Now, think of it as a temporal structure or maybe a gland that produces progesterone at that period. The corpus luteum start releasing progesterone into the bloodstream. I don't know if you understand all these things I'm explaining. Progesterone then prepares the womb for possible pregnancy, thickens the uterine lining, and keeps the womb calm. What happens if pregnancy occurs? Now, here is where you need to listen up. If fertilization happens, the early embryo produces a hormone called HCG. Now, this hormone tells the corpus luteum, don't stop, keep producing this progesterone. Progesterone is maintained because of HCG, that's a human chorionic gonadotropin. The corpus luteum stays active producing progesterone. At this stage, progesterone levels stays high just to support that early pregnancy. After the first trimester, that's after 12 weeks, the placenta takes over. When the placenta is developed, it becomes strong enough to produce progesterone on its own. Then the corpus luteum is no longer needed. This transition is what we call the luteal placenta shift. Now, if fertilization and pregnancy does not occur, the corpus luteum breaks down and progesterone level drops. Uterine lining shade, this leads to menstruation, that's your period. Now, why am I taking my time to explain all this? We really need to understand the role of progesterone, how it's produced, what it does in early pregnancy. And one of the things progesterone does in early pregnancy is that it prevents uterine contraction. Progesterone relaxes the muscles of the uterus. It reduces contraction that can push out the pregnancy. Progesterone keeps the uterine lining stable. It prevents it from shedding, prevents the uterus from shedding, which could lead to miscarriage. It supports blood supply to the developing embryo. Just think of progesterone as holding the pregnancy in place. Progesterone helps to modulate the immune system. Now, this part is very interesting. Baby is genetically different from the mother, that's half from the father, that's half chromosome from the father. So the body could see it as foreign. Progesterone helps to suppress immune reaction, preventing the body from attacking the developing embryo. It helps the body accept pregnancy. Early pregnancy is heavily dependent on progesterone. Progesterone also helps support early placenta development, which will later take over nourishment and hormone production. So what happens if you have low progesterone, particularly in early pregnancy? Low progesterone is sometimes called the luteal phase deficiency. Weak support of the uterine lining increases risk of early pregnancy loss, spotting or bleeding in early pregnancy. So this is why in some cases, doctors normally prescribe progesterone in early pregnancy. And one of the reasons is to support early pregnancy, especially when there is a history of miscarriage, or even maybe when there is a bleeding in early pregnancy, or maybe when hormone level is suspected to be low, that's when progesterone level is suspected to be low. Some doctors do prescribe this and progesterone supplement just to help maintain or support that pregnancy. This reduces risk of miscarriage in some cases, particularly in women with recurrent pregnancy loss or proven progesterone deficiency. Now listen up, it is important to note that not all miscarriages are due to low progesterone. In many cases, low progesterone is as a result of non-viable pregnancy and not the cause. This means that if the embryo is not developing well, maybe due to chromosomal abnormalities, progesterone level will drop naturally. So progesterone support only helps when the pregnancy is variable and needs support, not when there's a genetic problem like chromosomal abnormalities. Now, this video is majorly for educational purposes. If you notice any symptoms that maybe you don't like, any pain during early pregnancy, make sure to meet your doctor, speak to your doctor immediately, don't delay. Now, if you like this video, don't forget to like, subscribe, and share. Bye.